Hi, my name is Ellie Russell, and today I will be presenting on my chosen nursing role. So, here's my table of contents. Really quick, I'll be going over 6 main points. Number one being role definition, consensus model, education and competencies, professional organizations, biblical perspective, and then Dr. Parsi's human becoming theory. Introduction. So, for today's presentation, I chose to unpack and dive into the role of nurse practitioner. Whether it be due to the drastic increase in population countrywide or globally, insurance difficulties, or overall just a lack of resources, there's no doubt that Americans experience frustration through the numerous obstacles that we have to go through in order to pursue healthcare or even just to make an appointment with the provider. 25% of Americans have skipped or delayed care due to not being able to get a timely appointment. That's something that I certainly have had happen many times, and I'm sure every single American has had that. The nurse practitioner role originated as an emergent response to the pressures of these unmet health service needs and with a purpose just to enhance healthcare access and timeliness of care. Nurse practitioners are a type of advanced practice registered nurse who bring a dynamic perspective and overall personal touch to healthcare. Another definition stated that they are clinicians that blend clinical expertise in diagnosing and treating health conditions with an added emphasis on disease prevention and health management. Role definition. So, right off the bat, the textbook goes ahead and defines the role of the nurse practitioner as it was developed for a way to provide primary care for the underserved. In 1965, the role of nurse practitioner was formally developed by Loretta Ford and Henry Silver. This program was developed in response for the need for providers in these underserved areas and overall to enhance and spearhead the nursing profession. This additional master level education and preparedness allows for nurse practitioners to deliver a broad range of services, which that kind of differentiates registered nurse from a nurse practitioner. It's not just bedside, but now nurse practitioners can include diagnosis and treatment of acute and chronic illnesses. Nurse practitioners provide primary, acute, and specialty care through advanced assessment, diagnosis, ordering, prescribing medication, and treatment of illnesses and injuries. Nurse practitioners are board certified in a variety of specialty areas, so this could include pediatrics, family, gerontology, women's health, mental health, and acute care. Defined by the AACN, Advanced Practice Registered Nurses, so this term APRN is used to indicate this master level preparedness who they are directly in the line of care. They directly care for patients, and nurse practitioner is one of 4 roles that make up this umbrella term. The other 3 including certified nurse midwife, certified nurse anesthetist, and certified nurse specialist. So APRN, Advanced Practice Registered Nurses, they have this set standard, also known as the consensus model, that was designed for regulation to address the irregularities in regulation of these 4 nursing roles. So the consensus model provides guidance specifically for each role, but for nurse practitioner regulation, along with set requirements for education, licensure, and certification. Nurse practitioners who follow this model are dedicated to the highest of standards of practice and are committed towards providing exceptional care. A key component of the consensus model is the acronym LACE, standing for Licensure, Accreditation, Certification, and Education. So this applies to all 4 of the specific roles, but in terms of nurse practitioner, so licensure is, of course, the authority to practice, accreditation, formal review and approval by a recognized agency of educational degree or certification program. Certification is formal recognition of competency demonstrated by the achievement of standards, and education are formal preparation of APRNs in graduate level mastered programs. Education to pursue becoming a nurse practitioner. So first and foremost, you have to be a registered nurse. So whether you pursued your ADN, BSN, or a transition program, you have to firstly be a registered nurse. Nurse practitioner education builds upon this foundational RN knowledge and experience. Once at that point, you have to complete a nurse practitioner focused graduate master's or a doctoral level program. Upon completion of that, the needed hours, you then have to pass the NP board certification exam. Nurse practitioners gain the advanced clinical knowledge and skills to diagnose, manage, and prescribe medication and treat. Now, in regards to credentialing and the legality of being a nurse practitioner, every state is a little bit different and depends on the state that you are practicing, but according to the California Board of Registered Nursing, there's essentially 3 steps that allows you to be a practicing nurse practitioner. So number 1, you must hold a valid and active registered nursing license issued under state boards. Number 2, possess a master's degree or doctoral degree in nursing or a clinical field related to it. Number 3, successful completion of the NP program approved by the state boards. Nursing competencies, so the NONPF in our textbook as well lists the 9 nursing competencies for nurse practitioner. So there's scientific foundation, leadership, quality, practice inquiry, technology and information literacy, policy, health delivery system, ethics, and independent practice. And all 9 of these competencies, although are extremely unique and purposeful in a specific way, each one of these 9 all work towards enhancing self as a nurse practitioner and enhancing productivity, enhancing patient outcome, enhancing hospital collaboration, hospital environment. Just altogether, it's a cumulative effort. So these are the listed 9 that essentially are vital for success as a nurse practitioner and overall excellence in the specialty. So competency-based education is a curriculum that holds students accountable for the mastery of these competencies deemed essential. The competencies are vital for role development, useful for developing curricula, and evaluating nurse practitioner students during training. Professional organizations for nurse practitioners. There are a variety of professional organizations in our country that represent nurse practitioners. The most common ones that we see are the American Academy of Nurse Practitioners, AANP. This is the largest national organization that promotes advocacy, education, and supports nurse practitioners as well as just advancements for the profession. California Association of Nurse Practitioners, CANP, that is a state-based organization for nurse practitioners working towards, again, advancing the profession and enhancing independent potential and excellence in nursing practice. Another one is the American Nurse Association, ANA, and that is dedicated in leading the nursing profession and spearhead the future of healthcare. There are various other specialty organizations, so there's organizations for pediatrics, for mental health, for women's health, gerontology, so each one of those that nurse practitioners can specialize in, there's also a professional organization. So there's a ton that nurses and nurse practitioners can be a part of. These professional organizations support and contribute to the dedication of nursing excellence and serves as a safe space for all providers, for nurse practitioners to join forces towards creating a common goal and mission. By forming this community, nurse practitioners can advocate for their profession and continuation in setting the standard for patient health and well-being. Next, we have biblical worldview, so just a little bit about how the qualities and characteristics of the standards of being an excellent nurse practitioner 100% falls in line with scripture and just having a biblical perspective and a heart for Jesus. So the Bible verse that I chose is 1 John 3:16, and it says, "This is how we know what love is. Jesus Christ laid down his life for us, and we ought to lay down our lives for our brothers and sisters." The act of caring, compassion, and the call to love and serve others is depicted time and time again throughout Scripture. We have countless amount of parables. We have all the miracles and life of Jesus, but most of all, we have the death, the resurrection of Jesus that serves as the blueprint model of caring. As faith-based, so a study that was conducted said that as faith-based behaviors increase, the more likely nurses viewed their work as a calling and was motivated by the vital worth of each patient. So having this biblical perspective, having a heart on fire for Jesus, makes us just motivated and happy to love on our patients and to be the image of Christ. You want to be the image of his kingdom, and we know that we are placed in this role purposeful, that we are serving the Lord through the ability to serve others as a nurse practitioner. So really just having a biblical perspective is transformative in patient care and patient outcome. And unlike traditional providers, nurse practitioners have the privilege to be in a position of authority, but with a firstmost foundation in patient care that they originated and developed as a registered nurse. Having been a registered nurse first, nurse practitioners have the ability and knowledge of caring for patients holistically and not just symptom-based focus, but rather aim to care for patients physically, mentally, and spiritually. Having a biblical perspective as an NP means to love as Jesus and really just be the hands and feet of him. Dr. Parsi's human becoming theory. So right off the bat, Dr. Parsi writes that the human universe is indivisible, unpredictable, and ever-changing. This theory of human becoming is essentially, it's a nursing theory that emphasizes the individuality of each patient and recognizes their limitless ability to grow and transcend. It encourages nurses to care for patients comprehensively, with an intentional and compassionate care, and prioritizes patients' hopes and dreams. Parsi's theory of holistic care supports the role of nurse practitioners in their dedication to both the art and science of nursing practice. So, a concept from Dr. Parsi's human becoming is the concept of meaning. So, meaning moments change with new experiences that shift imaged values, shedding a different light with the becoming visible, invisible, becoming of the emerging now. So understanding patient meaning is imperative for positive patient outcome. Nurse practitioners should always individualize and tailor care to the specific desires of the patient. Something that I have learned in my nursing practice and from fulfilling my community health hours in Thailand last semester, I just was able to see that patients are so much more than a number in a room, a number in a bed. These patients have just like you and me, we have lives, we have family members, we have loved ones, friends, and we have hopes, we have beliefs, we have wants, and every patient is so different, and every day is not the same. We are continuing just changing every single day what means to us, what is important to it, what we value. So it's important as a nurse to just understand meaning and understand that meaning looks different to me than it does to my patient. So I think that is something that's imperative as not only a registered nurse, but especially as a nurse practitioner. All this to say that the nurse practitioner role is without a doubt thriving and a vital resource to the U.S. healthcare system. According to the Bureau of Labor Statistics, nurse practitioners are deemed the fastest growing jobs nationwide with an estimated growth of 45% by 2032. Nurse practitioners were originally created to meet the demands and needs of the underserved population, and this remains entirely true today. Not only for the underserved, but for people like you and me who we simply cannot get an appointment with our provider, that it takes months to be seen, nurse practitioners are a wonderful resource that allows us to seek healthcare and to be seen. With the continued increase in population and multiple hurdles to the access of healthcare, patients are looking towards nurse practitioners to fulfill their needs. The role of nurse practitioners is extremely rewarding and empowering as they have the unique skill set of originating from a compassionate nursing care as a registered nurse to now being mixed with advanced education in diagnosing and treating. By creating more nurse practitioner roles, it provides relief for providers and gives patients the opportunity to be seen and cared for in a timely manner. nurse practitioners contribute significantly to the healthcare system and will continue to serve as an essential resource for patient care and patient well being. Here are my references, and then the next slide is the end. So, thank you so much for listening to my presentation. Bye bye.